we're going to continue our discussion now about the infertility part of patients' care. And to start, what is the definition of infertility? What do we mean by that? I mean, when a lot of people hear it, but we don't know exactly that much of details about it.
Very good question. So infertility is defined as when a couple has been trying to have a child for 12 months or more, and then they fail to have a pregnancy, that couple will be considered infertile.
Okay.
So this 1 year definition is by WHO. It's not applicable to all, because if a couple has already tried and have been having unprotected intercourse before they started actually trying, you don't have to then wait 1 year. Or if a couple is advanced age, then you don't wait for 1 year. For example, if both of them are in their late 30s or early 40s, you want to proceed quickly rather than wait for that strict definition of 12 months.
Sure. And what are the most common conditions from your current practice experience which is contribute somewhat to infertility? You mentioned, for example, advanced age. Even that the 30s, I don't consider it advanced age. I mean, but what else could be a factor in that?
So factors can be surgical, could be medical, hormonal, so many causes, but since you asked for most common causes, on the male side, the most common cause that we see in infertility clinic is a condition called varicocele, which is basically varicose veins like people have in their legs. So dilated veins that cause the impaired function of the testicle. In human beings, primates, the testicle needs to be at a lower temperature than the rest of the body to work properly. Typically the temperature is 1.5 degrees lower. But when you have this condition, varicocele, all the veins are jumbled up around the testicle and the blood just pools and sits there.
Sure.
And so the temperature is not regulated properly. And that affects the sperm production, that affects the hormone production. And in long run, sometimes you'll see the testicle starts to shrink and testicle loses its volume also. And some of these patients later in life can also have trouble with low testosterone, and that can cause further many health problems.
Sure.
So that's one of the conditions we see most commonly. Other condition which is becoming more prevalent, unfortunately, is the use of exogenous supplements. So younger kids, younger folks, not knowing they're going to gym, they want to buff up, they start taking hormones. So-called natural way also has hormones in it. When somebody says I'm on pro-hormone, it's still hormone. In a male, if you give testosterone in any form, it's basically giving them birth control.
Sure.
Like in women, you get hormones for birth control pill. In male, it does the same thing. It suppresses their hormone production. So these are the two probably most common causes. Uncommon but most concerning cause is underlying malignancy. Many patients with testicular cancer, the presenting symptoms will be infertility or subfertility. So anytime we examine somebody, that's the biggest fear in our mind, to make sure that's not the cause. And if you miss that, it's life-threatening.
And when we are talking about each one of these medical issues, percentage-wise, when it comes to the male infertility, I mean, what's the percentage? Like, is it a small number of people who could have that problem, or it's a large number, percentage-wise?
So all the couples, when they're looked at coming into male infertility clinic, 50% of the couples in the males will have varicocele.
50%?
Yes.
Wow.
So that's the most common diagnosis. Now, testicular cancer or other malignancies, for example, lymphoma can present like that.
Sure.
Some patients who have craniopharyngioma. Some recently I saw a patient who had adenoma in the pituitary gland, which is a master gland that controls all the hormone production. So that patient presented with infertility. Rather than just saying, okay, you have low sperm count and writing it off, you have to look at the whole person, a human being, as to what is the cause behind it.
Absolutely.
Rather than just writing it off.
What about the woman side of the infertility? I mean, what are the most common causes from your experience, since you guys are in one clinic?
So in our collaborative clinic, when I work with my partners on the female side, their most common cause is hormonal dysfunction. Polycystic ovarian syndrome, also called PCOS, is one of the very common causes of infertility. Low ovarian reserve, or the so-called ovarian failure because of previous exposure to medication, hormones, or genetics is also another common cause. And as you know, for all diseases, obesity is wreaking a havoc.
Sure.
And both in males and females, obesity and BMI is directly, it interferes with your hormone excess.
Absolutely.
And it can cause problem with fertility.
So I assume, based on what you are suggesting, to figure out the reason for the infertility with the couple, specific couple, that the evaluation should be done for both of them.
That's
full evaluation to come up with the best answer, that where is the problem and how to treat it.
Absolutely. And this is right on the point. 30% of the men will have isolated problem when you have an infertile couple, only with men. Another 20% you will have men and women. And another 50% will have women itself only. So when you look at it, it's half and half, where man is involved and female is involved. It takes two to tango. It takes two to make a baby.
Absolutely.
So you want to make sure both the couples, both the partners are fine, and proceed, because you have done a big disfavor of just taking sperm from somebody or operating on somebody, not knowing what their partner's fertility potential is.
Sure. Now, based on that, what are the diagnostic tests which should be done after your initial interview with the couple and come up with the best answer possible? What are the most common diagnostic testing which done in these infertility clinic?
So the first thing is a thorough male physical examination focused on the genitalia.
Yeah.
There are many diagnoses you can make clinically. For example, we mentioned varicocele. It's a diagnosis of clinical examination. No tests are needed. You don't need a CT scan or MRI. It's a clinical exam test. There are conditions where the vas deferens, the tube that brings the sperms out, could be absent. Patients who are carriers of cystic fibrosis, they may have absent vas deferens. So once again, it's a diagnosis of clinical examination.
Sure.
And once again, I want to keep on saying it again and again and again, that testicular cancer, feeling for a nodule on the testicle, making sure the testicle does not have a missed condition of testicular cancer underlying. So good physical examination is required for that. Since the age group where the testicular cancer is most common is 20 to 40, that is the age group for maximum fertility in men. So these two age groups overlap quite a bit. So physical exam, complete history taking, including if they're taking any nutrition supplements, any protein supplements, any hormones, any over-the-counter medication, detailed history, not only on the male, but also the female, then family history, their pediatric history, so good examination. Once we have that, then we have a baseline semen analysis. So semen examination to look for your sperm counts, motility, morphology. A very specific things we also look at is, are there any infection issues, like there are white cells in there. We also look for any abnormal shapes. There could be good counts. If they're abnormally shaped, you're not going to have a good outcome. So a complete sperm examination in an infertility lab is very important. So then we go from there. In some men, you will, based on examination, you will check their hormones. It could be low testosterone issue, or hormone called FSH or LH, which come from brain. You have to do that examination. And rarely you will also require genetic examinations, Y chromosome microdeletion, or extra chromosome, X chromosomes, Klinefelter, one of the common causes that we see come across for infertility.
Now, when we are talking about the sperm counts and morphology and function, normal number of sperm does not mean you are fertile.
Very good.
Based on what I understand.
That's very true, because looking at numbers is just the quantity. What is the quality of the sperm? So those are some of the other tests that you have to delve into detail. Currently, science is not there where you can have just one test that can tell you the fertility potential altogether. So you may have to run a bunch of tests depending on patient's scenario.
Absolutely. Based on that and what you are suggesting from treating these medical condition which is leading to fertility in men and women, what is the success rate of the fertility clinic? And I know that you do a collaborative effort with your colleagues. to have a couple coming to the fertility clinic to produce or have a child, which is their dream?
I think the answer to that will be very variable, because there's so much involved on the female side, on the male side, the cause of infertility. So if a couple is coming in for a reversal of vasectomy, which is again very common these days.
Sure.
So depending on the duration of the vasectomy, you reverse their vasectomy, freshen the ends, put the vasa together. The patency rate could be as high as 70-80%.
Okay.
And return of sperm is seen in these patients, which can be utilized for pregnancy, or they can have spontaneous pregnancy afterwards,
Sure.
which could be to the tune of 40-50%. For varicocelectomy, the sperm improvement is seen more than 3/4 of a patient after varicocele repair. So depending on the causes behind it, and hormones, you get excellent response once you correct the hormones. Say if somebody is taking exogenous testosterone. So 90% of these men will have excellent outcome once you correct their pituitary gonadal axis, and they'll have very good pregnancy rates.
What about any kind of lifestyle modification which could help these medical conditions? Now, some of it, we understand it's surgical. It has to be done a procedure to reverse it. But if there's any lifestyle changes the couple can do to improve the chance of having their dream baby?
Excellent. There are so many things we can do, Amir. My biggest pet peeve is when I see patients, I tell them that the design of the nature is such that we have to have a healthy parent to have a healthy offspring.
Absolutely.
So smoking, that's one thing you can quit, big lifestyle change you can make. If they're drinking heavy alcohol, marijuana, people think it's harmless, but over years, marijuana use can cause low testosterone, problem with erectile dysfunction, increases your prolactin. It can wreak havoc with young person's fertility. So you have to make these changes. Obesity, as I said. So in the fat cells, testosterone is converted into estrogen, which is a female hormone, which in turn stops your sperm production.
Sure.
So if person is morbidly obese, first thing you start telling them is losing weight, eating healthy. Anything that's heart healthy is good for fertility.
You see,
As
that's
simple
why
as
we
that.
always say that the heart health is number one, even for fertility. So
That's right.
the final question which I have really, which is most of the people talk about the financial cost of fertility and these infertility clinic. Can you give us, in summary, very short answer about how costly it is and if the insurance cover that or not?
So most common condition, varicocele, 99% of the insurances cover it.
Okay.
Male infertility majority of it is covered, except for certain procedures like VAS reversal, vasectomy reversal. Those may be out of pocket depending on your deductible and all.
Sure.
If there's somebody has to pay totally out of their pocket, I think it runs anywhere from $1,500 to $2,000. I'm not sure, about the cost, what the university sets.
Okay.
On the female side, it's a little more expensive. Once again, diagnostic part is all paid for, but when it comes to intrauterine insemination or artificial insemination, it probably is less than $1,000. I think it's few $100s. If it's IVF, which is in vitro fertilization, then it runs into thousands, which is the most expensive. It probably runs around 10 to 12,000 per cycle.
Perfect.
And depends on the hormones.
But at least we know that at the end result, there is a good chance that they will have their dream baby, and that's the most important thing.
You're right. So we hope so.
Thank you so much.
You're
We
welcome.
appreciate it. It was very informative, and really we hope we provided enough information about this subject.
Thank you, Dr. Kapoor, for giving us this opportunity. Today we have a couple with us, Chad and Laura. They're here to share their journey about the issues we just discussed. How infertility can be a marker of some serious underlying disease and should not be taken lightly. So my pleasure to have Tuckerman.
Thank you.
First of all, I want to really thank you for being here from the core of my heart. It takes a lot of courage to share your story, and I want to let audience know that how they have taken this cause and close to their heart, and they're making public aware of what they went through so that nobody else has to go through it. So if you could walk us through your journey. How did this all come about? How long were you trying to have a child? When did you guys get together?
Okay. Well, we've been married a little over 5 years now in December. We started trying to have children immediately. After about a year, we weren't successful. We had done all the things, the calendars, the ovulation kits and everything. And then finally Lori decided that maybe she should go see her OBGYN. So that was kind of our first step. And at that appointment, most of the stuff checked out pretty good for Lori, but she also ordered a sperm analysis for me, which showed I had a low count. And she mentioned then I should probably go see a physician for that. So I had talked to my primary care provider, and he gave me the choice of either going to see a urologist or a reproductive endocrinologist. And so we went and seen a couple of different reproductive endocrinologists.
And Chad, this is not unusual, because people, when they think about having a child, their first reaction is where the artificial reproductive techniques or assisted reproductive techniques are offered, and mostly they think it's going to be a gynecologist. But the fact that you had a low sperm count obviously need to be looked at, and the person to do that would be a urologist who has expertise in this area.
Yeah, so that was kind of a tough decision back then. I think we got wrapped up in the whole thing of let's have a child, and I always had in the back of my head, well, why is my count low? Is there a reason? Is it overweight? Is it hormonal, dietary? Is it lifestyle? There's got to be a reason. It's just, God didn't invent us that way to have low count. So we seen one and had one artificial procedure, just an IUI done with no success. I still remember that day you looked at him, and we finally asked, didn't we, honey? We're like, okay, why is my count low?
Very good, yeah.
I'll never even forget that he said, it doesn't matter. The only way that you guys are going to get pregnant is going through IVF. So I never had really any hormonal panels, no testicle exams, no ultrasounds from either one. So
at this point, we were probably about 3 years into trying, nearly 4 years, but at the point of going through the process of going to my OBGYN and then going to the first reproductive specialist and then waiting to get into the next one. So yeah, it was a long couple of years just trying and being hopeful.
Just the one day I said to my primary care again, what's going on? Why is my count? Well, let's send you to your urologist. And then hence, that's when I teamed up with you, and you did a thorough workup for me. And I really had no symptoms until you did a testicular exam that, my left testicle was much smaller. I had a little pain that we thought might have been epididymitis, and got put on some antibiotics, and then really had no other signs. No swelling, no pain, no discomfort. None of those other signs you typically would think somebody with testicular cancer might have, that get that really enlarged testicle and discomfort. And right after the exam you did, you ordered the ultrasound and hormonal panel, sperm analysis, and at that point, if you remember, I had no count left. So we kind of even got robbed the option, I think, by then, to even if we decided to do IVF, we were at a point that we didn't have that decision any longer.
So from a very low count, from low count to very low count to no count. So the progression happened over 5 years, and that was something that there were red flags every step of the way to look into why of the things, rather than just saying, I'm kind of flabbergasted that you got the opinion as to it doesn't matter. It does matter.
It does. Because if you can, in my viewpoint, if we can save one male from going through chemotherapy like I did, I had so much struggles going through chemo. I had blood clots, PEs. You have the risk of chemotherapy down the road. If we can get just that couple to think, yeah, you want a child, but make sure you're getting checked out completely. Because if you can catch it early and go under surveillance and avoid chemotherapy, I'd have loved to have been in that situation. But unfortunately, I wasn't. Mine had spread to the lymph nodes by then, and I thank you for doing your due diligence, because I'm hoping, it's been a year, so I'm hoping I stay cured. And had to go through the chemo, of course, I didn't like, but I think if we wouldn't have come to you, it would have just slowly kept progressing. So we didn't really know the type of testicular cancer I had because the tumor was burnt out, but it definitely had a benign course. It could have been much worse. I could have had lung mets and things, so I'm glad finally somebody picked up on it. So
Chad, I remember very well, and I didn't express it. When I first examined you, that irregularity I felt in the testicle was very concerning to me. That's why you saw that rush in the approach that we went through. And it was a very short period of time. Rather than delaying it, we just went through very quickly to get our diagnosis and to get the treatment protocol started.
Yeah, I think I saw you on July 5th, and I was in surgery by July 6th with you. From having the hormonals, the CT
Yes.
scan in the morning, your
Yeah,
call by 10 a.m., and in surgery by 3. It was a whirlwind for us. I mean, not only for that, but the infertility slap that, you know, it was ultimate. Yeah, I have cancer, but it was also that at that point we weren't going to have natural children. That hurt just as much. I mean, so it was if we can help somebody still naturally be able to conceive and not have the chemo, but you never know what holds in the future for us. So
Absolutely, always stay hopeful.
Yep.
I want to thank you for sharing your experience. I know no hindsight is always 20/20, but I think as physicians, as professional yourself, and very educated couple yourself, you know, we can always go back and look at missed opportunities. So the missed opportunity in my mind was that you don't overlook a symptom. Low sperm count is just a symptom of something else going on.
Yes.
You know, and that something has to be looked into in detail.
So, I mean, even like you said, even if it wasn't cancer, even if you had like a spermatocele or something that surgically could be repaired, that your insurance is going to cover, where your IVF procedures are costing couples $15,000 and $20,000. I mean, that, you know, could be a simple fix.
Very true.
And the timing, you know, it took us 4 years to get here. Had we really researched and answered why and how and what else could it be, you know, rather than, you know, going after the hope of an instant child that we, you know, it would have possibly saved a lot of heartache and emotional and physical pain for Chad. So
Yeah, but it is your mind doesn't go to cancer. You know, when I had low, I'm like, oh man, it's the way I eat, it's my lack of exercise, it's being overweight. You know, you just never think, but until you work up and figure out exactly what is, it could.
So for the sake of audience, I think everybody needs to know that infertility can be a presenting symptom for testicular cancer. And patients who have sperm count abnormalities have much higher, 4 times higher incidence of having underlying testicular cancer or other serious diagnoses, undetected diabetes, undetected brain tumors. And we see that all the time. As you said, some of them are varicocele, which is one of the most common things. And all of these can be, you know, fixed, and if caught in proper time, could have been helped. So you're a great couple. You're such a loving couple. Tell me some of the things you've done so far to help communities since the diagnosis and since the treatment. I heard great things.
We started a cancer support Bible group through our church on Thursday nights for other caregivers and cancer patients. So we do that on Thursdays. I spoke at a UTMC Cancer Survivor celebration event, and it was great because I was there to give hope and inspiration to people, but yet I ended up getting that from them. So I think it was more I got benefit than what I gave to them. I heard so many stories of people and their struggles that they face and their fears, and so much similarity, even though different cancer types and stuff. But I walked away there feeling like I still had more hope and inspiration from the people that I talked to than rather me being there.
I'm so proud of Chad. His part of the theme behind his speech, and knowing the emotional struggle and the journey that he went through as well through this trial, he just encouraged people to tell their story, because like we're doing now, we hope to tell our story that maybe even one couple will hear it and do something a little differently and change their path.
I once again, people talk about heroes being basketball sports players, but if anybody needs to know, these are the real heroes who have taken their personal journey and difficulties and shared with the community. Thank you so much.
And likewise,
Thank
and
you.
what you do to
Yeah,
help
I think you're a hero
others
to
and
us. I mean,
inspire
I think
people.
there's so many people in the process that get underlooked, and I think it's just it's become like a family, and with the survivors we met and stuff, and being there for one another, because we're always going to face the fears and road bumps. I still have bad days. I still get, oh my God, when's the other foot going to drop? When's the cancer coming back? Same fears as all cancer patients have. So I think just having that tight-knit family and support group is community, I think is important. I think community is what got Lori and I through. It wasn't until we got involved in community, got back with friends, with family, with loved ones, the relationships, that really the cancer kind of took a side note.
It has been a blessing to meet people and people that have inspired us and carried us through the journey as well.
Yes.
Thank you so
Yourself
much
and your
again.
staff included.
I really appreciate
Thank
that.
you.
Thank you.
Thank you very much.
Sure.
Yeah, thank you. I appreciate it. Everything you've done. Okay, thank you.
Thank you for joining us. And again, after listening to all of this discussion, please, if you have any question, always go back to your family doctor. He will be the captain to guide you where to go. And please, remember, time waits for no one.